and welcome to Managing Your Medical Benefits at Retirement. My name is Melanie Denning and I work for the State of Montana Department of Administration, Healthcare and Benefits Division. The Healthcare and Benefits Division has the responsibility of managing the State of Montana Benefit Plan, or state plan, which provides benefits such as medical, prescription, dental, vision, and life insurance for State of Montana employees, legislators, retirees, and their dependents. If you have any specific questions that are not covered during this presentation, please call or email the Healthcare and Benefits Division, HCBD, at 800-287-8266, or you can email at benefitsquestions@mt.gov. So today, what will we cover? Today we will talk about what is the State of Montana Benefit Plan, or state plan. We'll ask, are you ready to retire? We'll talk about state plan retiree eligibility, alternative coverage options, rates and available state plan benefits, website and resources for more information, and some what next and contact information for you. Before we dive into a full discussion about managing your medical benefits in retirement, let's first take a minute to discuss a little bit about the State of Montana Benefit Plan, or state plan. Remember, the state plan is self-funded. That means that the State of Montana is funded by monthly employer, employee, legislator, and retiree contributions. The contributions are held by the state plan and then used to pay state plan expenses, the vast majority of which are claims. The State of Montana Healthcare and Benefits Division hires third-party administrators to process claims and provide customer service to all of our members. Allegiance in Missoula, Montana, is the administrator for the medical plan. Delta Dental is the administrator for our dental plan. Cigna for the vision plan, and Navitas is the administrator for our prescription plan and the Medicare Part D prescription drug plan. Before I begin today's presentation, I have a question. How many of you feel like you can just confidently raise your hand and answer, I'm ready to retire and I have planned well? How many of you, on the other hand, can relate to this photo? The photo says, I don't have all, not even some of my ducks in a row, but they're all in the same pond, so I have that going for me, which is good. Let's talk about some interesting retirement statistics. According to a recent AARP survey, 40% of us plan to work till we drop. Also, based on a report from the Center for Retirement Research, only about 30% of households who choose to take Social Security benefit are prepared for retirement. And according to the Employee Benefit Research Institute, about 14% of American workers are confident that they will have enough money to live comfortably in retirement. One other statistics, did you know that healthcare continues to be one of our largest expenses in retirement? You probably knew that. According to Fidelity Retiree Healthcare Cost Estimates, an average retired couple age 65, and this has been a couple years ago in 2019, may need approximately $285,000 saved after tax to cover just healthcare expenses in retirement. The key learning points to these statistics and these slides is to please do homework. You need to prepare early in the career. There are a lot of things to consider and plan for during retirement, and one of the biggest is maintaining your medical benefits and having enough income to cover the cost. Let me start out by prefacing our discussion today and saying this. Right now, in this presentation, some of you are eligible to receive state plan benefits in retirement. Now that's retirement state plan benefits, and some of you are not. So realizing that the object of today's presentation is to provide you with the information necessary for you to prepare for retirement, we need you to first listen and discuss who has access to state plan health benefits. You may continue coverage with the state plan. Remember, this is your medical, prescription, dental, and vision benefits. If you are also eligible for, at the time you leave, to receive a retirement benefit under your applicable provisions of the retirement system you belong. If you wish to continue coverage, you must notify Healthcare and Benefits Division, or HCBD, of your decision to elect retiree benefits within 60 days of the end of your active service. Let's talk next about who you may cover. Retirees have access to the coverage until their death. Spouses and domestic partners have survivor rights if they're covered the time of the retiree's death. Children can remain covered until age 26, and retirees can add dependents, spouses, domestic partners, and or children within 60 days of a qualifying event or during open enrollment yearly, which provides an effective date of January 1st of the following plan year. If at your separation from service, you're not eligible to receive a retirement benefit under your applicable retirement system provisions, then you would be eligible for 18 months of COBRA coverage. COBRA coverage is required by federal law and provides the opportunity for employees and or their covered dependents to continue group health insurance coverage due to a qualifying event such as termination of employment or loss of plan eligibility. COBRA is also an alternative option to state plan retiree benefits for those who are eligible to receive a retirement benefit at their separation. So keep in mind, there's a cost difference between retiree benefits and COBRA. COBRA is cheaper than retiree benefits, but the biggest difference is the period of time on which you may remain covered. It's lifetime for state plan retiree benefits versus 18 months for COBRA coverage. Additionally, you have other choices for maintaining medical benefits independent of the state plan, whether you are age 65 or not. So always keep in mind that you may have coverage options as a dependent on another policy, including a state plan policy, if you're married or your domestic partner of another state of Montana employee. If you're under the age of 65, you may, of course, as previously mentioned, choose to stay on the state plan with retiree benefits, or you may elect COBRA coverage for a maximum of 18 months, or you may elect coverage as a dependent on another policy. And last, you may purchase coverage on the health insurance marketplace. Here are some helpful resources and websites for reference and research on the marketplace: MontanaHealthAnswers.com and healthcare.gov. If at separation you are age 65 when you leave employment, again, you may choose to stay on the state plan with retiree benefits, elect coverage as a dependent on another policy, elect COBRA coverage for a maximum of 18 months, or you may elect to enroll on a Medicare supplement plan or a Part D prescription drug plan. Here are important resources for that research: the SHIP program here in Montana, the Area 4 agency here in Helena that you may call or email for more information. A very important thing to keep in mind: if you fail to elect state plan retiree benefits within that 60-day time frame, or you decide to terminate coverage after you make an election, you are not provided an opportunity to return to the state plan. To summarize then, at retirement from the state of Montana, you have some options regarding your benefit coverage. So you may continue coverage under the state plan, either with retirement benefits or electing COBRA, or you can stop coverage or discontinue coverage with the state by electing other coverage, such as through the health insurance market plan or a Medicare supplement, or you could possibly transfer to another plan as a dependent, state plan or other coverage. But if you leave the state plan, remember, you may not come back. So here's some scenarios for you to consider. What if your spouse is covered under your state plan but is not retiring when you are? If your spouse is a state employee, then they may stay an active member and you will move to their state plan and become their dependent. Regular employee contributions will apply, and the state plan will be the primary payer, even in the event that you are over 65 and have Medicare. If the spouse is not a state employee, then you may leave the state plan and gain coverage under their group sponsored plan, but you may not come back to the state. Monthly health insurance premiums may be your greatest retirement expense. If you elect state plan benefits in retirement, you'll be responsible for 100% of the contribution. As a retiree, you are not eligible for the employer contribution any longer. This slide reflects the monthly contribution amounts for state plan retiree benefits based upon your enrollment if you are not currently eligible for Medicare. These rates can be found on our website at www.benefits.mt.gov/resources/rates/2021. This slide reflects the monthly contribution amount for state plan retiree benefits based on your enrollment if you're eligible for Medicare. They may be located at the same website address listed previously. In addition to the monthly costs presented on those previous slides, the state plan also imposes a tobacco surcharge for our members who use nicotine. The surcharge adds a $30 amount to the monthly contribution for those employees or retirees who use nicotine. There is an additional $30 per month also added if that employee or retiree's covered spouse or domestic partner uses nicotine. So when you're completing your enrollment elections, you will be required to indicate if you're nicotine-free or a nicotine user. And the definitions of nicotine and nicotine-free are shown on this slide. Nicotine is an addictive stimulant proven to have negative health effects, and it's found in cigarettes, cigars, chewing tobacco, and most vaping products. You are nicotine-free if you've never used nicotine, or if you've quit using it, or you infrequently use nicotine, such as 4 times a month. You are also nicotine-free if you're currently using nicotine but have completed an eligible alternative, a nicotine cessation program, or a nicotine counseling session with a medical provider during the last 12 months. The definition of a nicotine user is that you are a nicotine user if you're currently using nicotine and have not completed an eligible alternative, such as a nicotine cessation program or a nicotine counseling session with a medical provider in the last 12 months. This slide reflects the monthly contribution amount for state plan retiree benefits based on your enrollment for dental, vision hardware, and basic life insurance if you are under 65. Once you turn 65 years old and you're already a retiree, in order to obtain the lower monthly medical premium rate, you must provide us a copy of your Medicare card. And this would show enrollment in Part A and B to the Healthcare Benefits Division. Then we will reduce your rates the first of the month that you are eligible. Medicare claims are paid first by Medicare, and then state plan will pay second. You may elect to pay for your benefits in a number of ways. You may elect to prepay. You can do this through the year in which you retire via payroll deduction. Or you may elect to have your premiums automatically deducted from your monthly PERS or Impera benefit. You may also have an electronic deduction from your bank account. If you are a VIVA participant, you must also elect ACH or the Impera option, and then you will be reimbursed monthly from your VIVA account for the amount of the premium that you paid. If you choose to elect state plan retiree benefits, non-Medicare retirees are required to retain the medical, which includes the prescription drug coverage, dental, and basic life insurance. Non-Medicare retirees or under 65 are eligible for optional benefits that include coverage for your dependents on medical and or dental, as well as the vision hardware coverage. If, on the other hand, at retirement, you choose to elect state plan retiree benefits and you're Medicare eligible, then Medicare eligible retirees are only required to keep medical, which again includes the prescription drug coverage and becomes a Medicare Part D plan. Medicare retirees are eligible for optional benefits as well, and that includes dental for self or dependents, medical coverage for dependents, as well as vision hardware coverage. Medicare retirees are not eligible for the basic life insurance plan any longer, but will be given the option to convert that coverage when they become ineligible. This slide details the state plan benefits you are no longer eligible for as a state plan retiree. And remember, all of your contributions are paid post-tax basis. Non-Medicare retirees are no longer eligible for flexible spending accounts, supplemental life insurance plans, and long-term disability plans are canceled. Medicare retirees are also not eligible for the flexible spending account plans, any and all life insurance, and it may be converted, and the long-term disability plan is also canceled at Medicare eligible age. Remember, all contributions are paid post-tax. As a state plan retiree, you are able to continue using the Montana Health Centers in Anaconda, Butte, Billings, Helena, and Missoula. The list of services depends on if you're Medicare eligible or not. Non-Medicare retirees may continue to use the health centers the same way they did as an active employee. However, as a Medicare retiree, then you are only able to use the health centers for your health screenings, flu shots, and COVID vaccinations when they're available. As a retiree, you can continue to earn the $30 a month off your 2022 benefit contributions by completing 3 activities: a state-sponsored health screening, being nicotine-free, or if you're not nicotine-free, completing an alternative, and completing and self-reporting an eligible provider visit. You may also double your incentive if a covered spouse or domestic partner covered on your plan also participates and completes all 3 activities. Remember, all 3 activities have to be completed to get any incentive. There are no partial incentives available. You must complete the activities, all 3 of them, between November 1 of 2020 and October 31 of 2021 if you are going to be eligible for an incentive in 2022. If you complete these 3 activities as an employee in these mentioned timeframes and then you retire, you will receive the incentive for 2022. It will transfer. As a retiree, you can continue to participate in this program for upcoming years. On the next slides, we'll discuss open enrollment. As a retiree, you will continue to participate also in open enrollment each fall, just like you did as an employee. Remember, this will be the opportunity to make any changes that you may have for the following benefit year. You will still be able to attest to your nicotine use annually to avoid the tobacco surcharge, as well as be required to re-enroll or enroll in the vision hardware every year, just like you did as an employee. The reattestment to your nicotine use is required annually to avoid the tobacco surcharge, in addition to participating in the Live Life Well discount. You must do both. You will be given access to open enrollment presentations on our HCBD website prior to open enrollment. It is important that you keep your address up to date in our eligibility system so that we can send you appropriate materials at open enrollment and you may receive them timely. www.benefits.mt.gov is a great resource for you to find out everything you need to know to become a retiree and then navigate the system as a retiree. Clicking on the Retiree tab will provide you useful planning information. The website is the same website you will use as a retiree to enroll in retiree benefits. Also, to make plan changes during open enrollment, update your personal information like keeping us abreast of your current address information. Also, you will report your wellness activities, and from our website, you may make your monthly payments. This view of the website shows you where to locate the rates if you're still an employee and you're working on your retirement plan. Rates will be posted each fall for the current year and the upcoming year. You may also locate more information regarding the tobacco surcharge on the HCBD website under this resources drop-down menu. You can then click on tobacco surcharge. Making your elections prior to your retirement date, there are some things that you may complete before you retire. One of those is your VEBA enrollment form if you are a VEBA group member. Also, if you want to prepay, you have the retiree prepayment option form available to you if you're not in a VEBA or if only your sick leave goes into VEBA, which then would allow you to pay your contributions utilizing your remaining leave balances through the year in which you retire. All other elections will be made after you leave, which includes Healthcare and Benefits Division mailing you a packet to allow you to elect your retiree coverage if you so desire. Remember that Allegiance will also mail you a COBRA packet. But remember, this coverage is only for 18 months, and after it expires, you may not elect further state of Montana coverage. As a retiree, who do you contact? Well, the answer is, it kind of depends. You can call Healthcare and Benefits to discuss your state plan benefit questions. If you have questions specifically related to your monthly retirement benefit, then you call Impera or PERS. If you have questions about Medicare, you will contact them. And the Social Security Administration is also a helpful planning resource. Please feel free to reach out. With that, we wish you well in your planning and ask you to contact us with any questions. Thank you.